we're really happy to have the DCW group join us in an educational webinar that's Q&A driven, because we found so many webinars. Well, let me just say this. We found so many webinars are presented in a one-way direction, and the fact that we're doing a two-way interactive dialogue is really important, because so many people still, the webinars we've done have lots of questions left over. So thrilled on today, we're talking about the upcoming webinar we have scheduled for Thursday, April 23rd at 11 a.m. And it's on employee benefits programs. And I have to start out with the one shocking thing that you shared with me the other day when we were talking. A COVID-19 code did not exist just simply a few weeks ago. I mean, it's just shocking to think so. So could you guys speak to the implications of that?
It is, Jeff. A lot of people never think about how basic it is to have a diagnosis code and a corresponding 5-digit procedure code. And that's what unlocks the payment mechanisms with the carriers. And I believe 13 days ago, those codes didn't even exist for providers to be able to submit claims for COVID-related illnesses.
Yeah, that's sort of been the theme here is there's a lot of announcements and a lot of things move really quickly, but then on the back end, they move very slowly. So if you take it a step further and you think about what Bob said, you've had mandates that have said, okay, we want you to waive the member cost share for COVID-19 related testing. Well, that's fine if you can identify what COVID-19 related testing is. And until they had a billing code, it wasn't even possible to do that. So that sort of has been the theme here of you'll get a legislative announcement that's followed by carrier-based announcements that we then have to disseminate to our clients and those who are curious. And most of the time, the announcements have outpaced the thought behind how do we actually execute something like that. Wow.
And so this newfound, we not only have testing implications, so it's just identifying the situation, future testing, keeping employees in your workplace safe is going to be a big issue. And as we get back to work here over the next couple of months and weeks and months in a very safe manner, I could see another thing that shocked me when you shared, going into the enrollment period next fall, we're going to see, no one anticipated this, right? So we're going to see some major changes to the premiums that employee benefit programs are going to have to support. Does that sound true?
That's a very fair statement. As we talked about last week, about 7 or 8 days ago, a new analysis published by California's ACA exchange called Covered California has projected that the COVID pandemic could cause premiums for individuals and groups alike to go up somewhere between 4 and 40%. Again, with a code that didn't exist 2 weeks ago, I don't think we've seen any claims even come into the pipeline to project what those increases are going to be, but the early indicators are they're going to be significant.
Yeah, and I think what, to Bob's point, you had some areas that you couldn't quantify, being these new tests that have lacked codes. But, one of the things that we are able to put our finger on is in the more complex later stage treatment, what does that cost distribution look like? And an initial ER visit with an intubation on the first day is going to run between $3,000 and $4,000 in the form of a claim. Inpatient days there on out will be between $1,000 and $2,000, and those that make it to the ICU are going to be somewhere between $3,500 and $4,500 per day. And that's why the same study from Covered California said that the 1 year projected cost for this in the commercial markets is going to be anywhere from $34 billion to $251 billion in the form of treatment. And when you think about it, last year, when the majority of employers went through their renewals, this didn't even exist. And now we're going to inject billions of dollars out into the marketplace. And to think that that is not going to be felt through corresponding rate adjustments is just incorrect. We will absolutely see that on a go-forward basis.
Wow. So the good news is we're having a preview conversation because we are here today on Zoom and Facebook Live promoting the webinar coming up Thursday, April 23rd at 11 a.m., which will be a very active and robust discussion. So the purpose today is to share with our audience the fact that this webinar is coming and that to get your questions ready, because not only are we going to dive deep into these topics, and if I'm scratching my head thinking, if I'm a CFO managing a very significant expense, which is our program, how do I start to prepare now? Like, what do I do now? And then I also want to plug the fact that not only will we'll be lining up questions, and you can submit those questions in advance to resources@business-journal.com. And then another thing we're going to discuss is in this new work environment, we've all had to adapt to shelter in place, work from home, virtual teams. Another bonus we have for this webinar is the fact that the DCW group has worked at a national level in a virtual environment for quite some time, for years now. And so sharing your best practices on the technology, the tools, the rhythm and the cadences you have as an organization to just still keep growing and seeing amazing results. And so that's also something I'd like to ask our viewers today and our audience here that'll be viewing this video to also get those questions ready. Here's an example of a great organization that's thriving in a virtual environment and in the things that they've done to do that. So I guess back to go ahead, Bob.
Maybe I'll take the first part of that question, Jeff, and then we'll leave the remote workforce and technology for Bob to follow up on, and I'll be anxious to interject some of my viewpoints about how we operate today. So obviously, as a CFO or business owner, their first concern is going to be, how can we best prevent this illness? How can we best protect our workforce when they come back on the job? And that is going to be to prevent them from getting the illness. The number one thing there is going to be social distancing. Mm-hmm. As we're seeing and hearing on the news briefings, whether you listen to our governor, Governor Cuomo in New York, the president and Dr. Fauci, everyone is talking about a slow and controlled release as we get back to some semblance of normal. But that's not going to happen quickly. So employers are definitely going to be taking every precaution that they can to prevent their workforce from getting the COVID-19 virus. That will involve social distancing, as I said, whether they're configuring how they're going to work within their workplaces. It's going to include probably scheduled hand washing, because that's one of the main areas that helps control the disease. And these masks, who would have ever thought that when perhaps our stay-at-home order is lifted, just as you've seen in Pennsylvania yesterday, masks are going to be part of the future, at least in the short term, for employers and employees trying to get back to some semblance of order. Yeah. And I'm sure folks are already thinking about how they're going to do that in their own workplaces, whether they've been deemed an essential business and have continued through the pandemic, or whether they're trying to figure out, the restaurants and others, how they're going to come back after things start to ease back in. Anything to add on that part, Bob, before we?
No, and I want to pick up on the remote work, Jeff, because what you hit on was something important. I mean, on the webinar next week, we're going to give out the technology that we utilize to put a remote organization together, and that's important. But technology like this, like video conferencing, is available on a fairly wide basis. And I think one of the things that is going to be important is, how do you manage a team and allow employees to feel active, productive, fulfilled, and balanced between work-life balance, when a lot of times now the line is completely blurred because they're all sheltering in place at their home? So I think that the expectation, at least as it pertains to our organizational structure next week, is we're just going to give out the list of the technology we use and a high-level overview of what it's for. And then more importantly, to your point, hit on that that cadence, that best practice, because being able to communicate via video chat, those services are out there and they're readily available. But how you use that and tie it into a larger strategy is definitely going to be important as well.
Right. And so what have you seen? Have you talked to, I'm sure you've been in touch with all of your clients. Have they, what, if you could offer a preview, say, what's the one key factor you would consider when we've been kind of forced to, shelter in place and turn into an instant remote organization?
Mm-hmm. Well, our business didn't stop, nor did anybody else's business really just stop. So we obviously had our pre-renewal meetings that were scheduled that had to take place virtually. We've had our renewal meetings that have had to take place virtually, but we were well equipped to do that. For us, many of them took place that way prior to March 17th was our first day of remote work within the company. So we have we too have had to adapt to the virtual environment to run our business.
I think, Jeff, if I had advice to people who are considering how to approach this model, I think it's one built on a foundation of trust. And what I mean by that is the chief concern and the argument against remote work pre-pandemic in a lot of ways was, well, how do I know everybody's really working? One of the things that we did was we switched our entire office over to Mac computers about a year ago. Mm-hmm. We were losing a lot of time with PCs, loading, slowing down, choking up, and we needed to be able to move fast. So that was one of the benefits. But the secondary benefit was if you're an Apple phone user, you can actually send text messages then from your work computer. And a lot of people said, why would you want to have the ability to do that? And our argument was very, very simple. People are going to text whether we're in an office or not. If we actually make it easier for them to do that and then return immediately to their work by having it on a centralized device, rather than picking up that phone and going from the text to Facebook or Instagram to somewhere else, we need to have an acceptance as folks that run organizations in leadership positions that there's already a lot of productivity loss when we're on site. And we need to have the trust in our workforce that they are going to deliver on the results that they have to provide. And that really, without getting too far into the details of some of the other things that we do, that has to be the foundation. As we convert to this path, you have to trust your team. And you have to accept that just because they're not there with you didn't mean that you didn't have those inefficiencies before.
Yeah, I can't tell you that. It's funny. Trust is probably the biggest tool we have. And there's lots of great technology out there, but you're right. In fact, I know we tools like HubSpot, right, in which you can see activity and you can see how many emails and calls and clicks and opens. That's great. But I think the bottom line is without trust and without the right company culture, we were having a debate. I was debating someone who was kind of against the whole virtual model. And I said, listen, chances are they'll be more productive if the only bridge back to their job performance is HubSpot. Because we can see everything they're doing. If we can literally put eyes on them in the office, there's a perception that they're working, but they're probably not actually working, or they probably could be doing more, I should say. Everyone works hard and, put that out there, but the perception that sometimes eyes on, oh, I'm at work. Well, are you working? Mm-hmm. Where if you're at home and your only bridge into performance and success is a HubSpot or a tool like that, you better believe they're actually going to be logging everything. And because we all work with high integrity people, they're going to want to know their, employers to know that, oh yeah, I'm actually doing stuff. So it's funny. Trust is the biggest tool we have. It's something I didn't think about. I keep thinking about Slack and Teams and, Google Drive and Google Docs and Google Sheets, but trust might be the number one tool.
Mm-hmm. For sure.
So that's good. So once again, for those of us joining, we appreciate it. This is our warm-up call to the webinar we have scheduled for next Thursday, the 23rd at 11 a.m. You can register. I'll put a registration link in the comments below. And you can always visit us on businessjournaldaily.com to register. And the goal is of this webinar, it's about the whole employee premium process, right? So kind of the benefits plans and the programs, and the forward-looking view, and preparing to for this renewal phase coming in the fall. And then productive environment. So if you have questions, you can put them on email as well, resources@business-journal.com. So I guess to wrap up our preview conversation, anything else you guys would like to add or share to get people ready for the conversation next week?
Oh, I think, Jeff, that the thing that I want to stress here is that we are going to have prepared content and things that we want to go over, but I want to really stress the opportunity here to provide the questions that you want answers to. We want this to be valuable for everybody who's in attendance, so provide those questions in advance. We'll then tailor the dialogue to make sure that we're hitting on all the points that everybody who's attending the webinar wants to know. For us, that's always the most important thing, whether it's a one-on-one meeting or something like this, is we want it to be valuable for the people that have taken the time to meet with us. And so that would be our only recommendation, my only recommendation at least, is send in the questions, let us know what you want to talk about, and we'll make sure that we tailor the dialogue to exactly what you want to achieve.
Yeah. As Bob said, we've been on, our company, ourselves, our employees have been on dozens of webinars. And right at the very start, it's always announced how fast and feverish the questions are coming in. And Jeff, as we talked about last week, they often get to 3 or 4 of them. We would prefer to answer the questions that the audience wants to know. We will have some prepared remarks. Maybe it will spark something for the attendees. We'll try to get to those as well, but we want it to be valuable to the readership and the attendees.
Excellent. And the good news is about the Zoom platform is you can ask questions as anonymous or as your individual, as you registered. So especially in areas such as programs like this, oftentimes you don't want to disclose potentially competitive information or sensitive, I'll just call it sensitive information. So that's a good news as well. You can log questions anonymously on the webinar, and we'll address them accordingly and make sure that they're covered and even sufficiently say it's such a very detailed and specific question. We not only can hit it on the webinar, but then we can also take it offline and make sure that we capture it. So I guess with that being said, I'm really glad we could jump on the Zoom today and do a quick preview of the webinar we have coming up next Thursday at 11. We hope everyone registers. We hope you attend. We hope you bring good questions and get ready to listen to great content, because we're in the midst of this crisis. And even though there's this opening up potentially that could be happening over the next few weeks and months, things will not change. I mean, everything's going to change.
Yep.
Yeah.
Everything's going to change, and we're in for a long road ahead of us. And we have, I heard Facebook last night said no events until July 2021 at a minimum. Nothing. They're just doing everything virtually. So embracing the virtual environment, embracing kind of the new normal in workplace and benefits programs, and protecting our employees, really investing in safe workplaces is going to be the new normal.
Agreed.
Absolutely.
Okay. Well, this is great. I appreciate your time today, and thank you everyone for joining us. Thanks. Great to see everyone on Zoom and here on Facebook as well. And we'll see you next week for the webinar, Thursday at 11.